I hope you know that malaria is one of the most prevalent diseases in Nigeria. It is wrongly diagnosed and treated by most people. In this video, one of our friends in the person of Dr. Destiny Onwosi will be educating us on the causes, the diagnosis and treatment of malaria. Have a beautiful time as you listen. Please don't forget to subscribe and share this video. God bless you.
Many of my patients have come to see me in the clinic and they are like, Doctor, I have fever, I'm not eating well, and I've already started treating malaria, but the fever is still there. It's not going. And then I will ask myself, man, what told you that it is malaria that you have? You just started having fever and then you think fever is equivalent to malaria. Don't you think that there are other things that can cause fever? And then I try to begin to talk to them. What is even malaria? Yes, malaria is caused by a microorganism known as plasmodium. It could be Plasmodium falciparum, it could be Plasmodium malaria, it could be Plasmodium ovale, it could be Plasmodium vivax. However, in Nigeria, 97% of malaria is caused by Plasmodium falciparum. And then when you have this, of course, it is going to start with fever because it's more like an inflammatory process. Your system is responding to whatever that this plasmodium in your system is doing. So as it is responding to it, it is producing toxins and chemokines within your system are also firing, releasing things that will make your temperature to be high. And when you now have this high fever, then you decide to treat. But before you go ahead to treat for malaria, it is important you do test because it is this test that will confirm that you have malaria. The problem there is that if you just continue to treat malaria anytime it comes, a point will come you get resistant to the ones you've continued to use. Therefore, each time you have fever, it's good you go to hospital to be seen. There are symptoms that can prove to you that you have malaria. When you begin to notice symptoms like fever, you may have cough, you may have vomiting, you may have abdominal ache. In fact, there is no particular symptom that is so classical for malaria, except when it has become severe malaria. Then you can have things like you can have confusion, especially in children. It can go up to the extent that you'll be very weak, known as prostration. It can also go to the extent that you become pale, you'll be anemic. And the best thing is still to come to hospital to be reviewed by a doctor. So when you come to the hospital to see the doctor will ask you some questions and then recommend some tests. This doctor may not only be looking at malaria, he may consider other things that can still produce fever or those similar complaints or symptoms. When he now make his test and then a diagnosis is finally made, you can be placed on the right therapy. The good thing these days is that even this test does not take time to be done. Take for instance, when you want to do MRDT. MRDT is a rapid diagnostic test for malaria that is done even while you are still there for consultation. All that is needed is that your skin will be punctured, blood will be collected, and in less than 25 minutes, your result is obvious. Yes, sometimes MRDT, malaria rapid diagnostic test, may not be exclusive. It may not be able to eliminate the possibility of you having malaria, but at least it could give us an idea of what is wrong with you. And when the doctor is aware of what is wrong with you laboratory, he can be able to commence you on therapy. And once you commence on therapy, it can begin to bring down whatever that is wrong with you. Now, when a doctor makes a diagnosis of maybe malaria or severe malaria, it will inform his mind of what to do, the kind of drug to give to you. The drug given to someone who has severe malaria is not same with the one given to someone who has uncomplicated malaria. When you have uncomplicated malaria, you are started up on combination therapy, artemisinin-based combination therapy. But when all you have is severe malaria, you are started up on a single therapy. You are either started on quinine, you are started on artesunate, or you are started on artemether. These are single dose or single therapy, unlike the artemisinin-based combination that is started for someone with uncomplicated malaria. And this is the reason why you have to come to hospital. Sometimes you can start treating ordinary malaria, that's uncomplicated malaria, as if you are treating severe malaria. At the end of the day, you see, you've ended up wasting your money, you've ended up causing resistance for yourself. And that is why it is good to see the doctor. Now, when you come to the facility, yes, it's going to be costly, it's going to cost you some amount of money, but be rest assured that you're going to get the value of services that is given to you. You can also get consultation online if that is what you want. You can call your doctor and ask him questions, and the doctor will answer it and then be able to place you on therapy. But the main target is avoid self medication. Self medication may not be exactly what you need for your health to continue to be in its optimum state. And this is very important for everyone, both the children and the adults. You need this advice and you need to comply. It's not every time you have fever that you go and start doing malaria and typhoid outside.